Welcome to the Health on Track podcast. Let's talk well-being.
Welcome to the Health on Track podcast, offering you a shot of wellness. I'm Yasmin, and I'm the Member Engagement and Communications Manager at GIG Gulf. Health is multidimensional, and in this episode, we're talking about the backbone of it, literally. Or to be more specific, we're talking about bone health and osteoporosis. I'm here today with Dr. Kutaiba Salman, consultant orthopedic surgeon from Adam Vital Hospital, Dubai, with over 25 years of experience in Denmark, Sweden, and UAE. He is a Danish certified and trained surgeon, expert in hand and wrist injuries, neck and spine pain, foot and ankle injuries, and sports-related trauma. Thank you so much for joining us today, Dr. Kutaiba.
Thanks for having me, Mrs. Yasmin. Thank you very much.
Of course. So can you start by telling us what is osteoporosis?
Yeah, so osteoporosis is a bone disease, which is, the meaning of osteoporosis is when the bones start losing the calcium and its consistency, and that will lead to its weakness and fragility, which might in the end lead to fracture. That's as simple as this.
So how does it affect us physically to have weak bones?
By having the osteoporosis, you risk that any kind of injuries, a simple fall or a simple twist, can lead to fractures, because you have the bones are weak and, I said, fragile, so that can lead to any kind of injury, direct injuries.
So how is it measured? How do you measure if someone has osteoporosis? Is it like a scale? So there are levels to it, or is it?
Yeah, there is difference between how osteoporotic is your bones or how weak is your bones. So we have the light kind of osteoporosis, which is just 30 or 40% of the bone strength is lost. We're talking about the calcium and the consistency of the bone, which is called osteopenia. And we have the severe form of osteoporosis, and that is usually happening with age, especially in elderly people. And that's, of course, the severe form of osteoporosis. And you can measure all these types of osteoporosis, and there are certain tests you can do to determine whether you have it or not.
Okay, so you mentioned old age, that it kind of increases, osteoporosis increases with old age.
Yeah.
Is that the only cause, or are there other factors that cause osteoporosis?
Osteoporosis can happen from different kind of causes and reasons. We can mention one of them is, of course, the aging. Others are some people they take some medication, and that might lead to side effects causing osteoporosis. Some of them having treatments for severe diseases, as for instance cancer. They are taking chemotherapy that can also lead to the same. You have bad diet, bad habits, I would also say, and there are many other reasons which can lead to the osteoporosis.
Okay, let's deep dive a bit into the bad habits and the bad diet that can cause osteoporosis.
Yes. The diet which is not containing good amounts or sufficient amounts of calcium, and I can mention in this here particular subject the loss of vitamin D. We protect ourselves, especially us who are living in Dubai and the UAE. We try to avoid the sun, especially in the warm months. So we're always hiding in AC environment, and not getting enough exposure to the sun.
Yeah, like vampires.
And that of course will give a lack of the vitamin D. So you get vitamin D deficiency, which is the main reason for having the osteoporosis. Because if you don't have enough of the vitamin D, the absorption of your calcium from your stomach will be decreased or sometimes inhibited, and that of course leads to the weakness of the bone. So it's very important to have always the vitamin D in level.
There's also this myth that certain soda drinks affect bone health and they cause osteoporosis. Is that true?
It could be true, but indirectly, because they are affecting, the layer of your stomach. Some of them have some chemicals, which we know. Some of it we know about, some of it we don't know about, because some of them, the companies, they keep it secret what they put in these chemicals. So that could affect your stomach, the layers of the stomach, leading to malnutrition, which is the less absorption of the calcium. So I would say it's indirectly. And this is one of the bad habits I mentioned in the beginning.
Yeah, this is why I wanted to deep dive so that we can highlight the things that are within our control. So aging is not really within our control, but
No.
diet is.
No, but we could minimize, or we could be always. I would always say that when you are moderate in doing things, you can protect yourself from many things. Because you can stop doing something which might lead to a decrease in some important factors. You might increase some things which might lead to side effects which can harm you. Like I know many of my dear patients who is taking excessive amount of supplements and minerals and vitamins without having a proper investigations done, and that can cause to serious issues later on in the long run.
Yeah, I was actually, I have some friends who told me, like, you live in the UAE, of course you should be taking vitamin D supplements. I'm like, what if I don't have a deficiency? Like, no, of course, just take it. You don't know, you never know.
No, yeah. No, I have also another example, which is because I was working, as you mentioned before, in the Scandinavia. And in the Scandinavian countries, as you know, there is like 3 months of summer.
Yeah.
And the people have great information and knowledge about the vitamin D and the sun and the importance of that. So I had one time a lady which broke her hip and she needed an urgent surgery. And that day it was a sunny day. So we were taking her to the operating theater, and she said, "Please let me go outside to take the sun before you're doing my surgery because it's
Wow.
important for my." So as things like that, having the knowledge and having the proper information about these kind of things, that will prevent you from many things.
Yeah, true. Okay, so you said vitamin D deficiency and calcium absorption is kind of what we can be working on to avoid osteoporosis.
Yeah.
So how can we do that? Should we just be taking supplements or?
So there are some symptoms related with that, not with the osteoporosis, because osteoporosis usually it's asymptomatic. That's why some call it a silent disease or silent killer, because it won't give you symptoms in the first, I would say, few years, until sometimes an accident happen, a twist injury or a fall, and then you get a fracture. While we're taking the X-ray, we can see that there is some weakness in your bone, and then we'll give you the diagnosis of osteoporosis. But generally, is some test is required to have this diagnosis. So yeah.
Does genetics play a role in osteoporosis or in bone health generally?
Definitely, genetics have a great role in the osteoporosis, and it's one of the main reasons why it could happen. And again, it's indirectly because it will, raise or decrease the hormonal level in your body, which can lead to the osteoporosis. In that manner, it can affect. Yes.
So the rumor that females are usually more affected by osteoporosis, is
True.
that true?
That's true. We have 4-to-1 ratio between male and females. So yeah, especially after the menopause, when they reach the age of the menopause, it's very important to have all the hormones always checked, and they should always be in leveled, and that's something you can do with like home testing or simple testing. That should be followed by your own family doctor or family medicine physician who is following your case and following your history or medical history. So I would recommend everybody when they reach that certain age, even for men, all these should be checked properly.
Yes, we do always encourage everybody listening to do the regular checkups and just make sure that they don't need any supplements or any support somehow. Okay, so are there any supplements or vitamins that you usually encourage your patients to use?
Yeah. Now, first of all, it's more important to have a proper diet, which fits you, and of course, it should be the healthy diet we're talking about, because if you're taking sufficient vitamins and minerals, you shouldn't need any supplements. It's always a good idea to take supplements if you have deficiency. And as we mentioned before, by doing the testing and the blood test and everything, you will find out where you need it. Yeah, because if you take certain minerals, for instance, you're innocent and you're just taking, like somebody told you, magnesium, for instance. You take magnesium, that might affect something else, another mineral, because it's always balanced in the blood. That's how we are built. Nowadays it's very easy to do all these testing, and then you can know exactly how much you should need and when you should take it, and so on.
Okay. What about treatment for osteoporosis?
Yeah. So the treatment for osteoporosis is actually prevention. That's the best treatment I would suggest for the osteoporosis. So when reaching a certain age, or when you think that you have malnutrition in a way or another, like if you are vegetarian or have certain kind of food that you eat or you don't eat, always a good idea to have a simple test, which is as simple as an X-ray, or some special kind of test, which is a scanning of the whole body, and that takes few minutes to do, and can tell you whether you're having it or not, or what is the degree of your bone health, I would say, and according to that you can supply your need.
But if someone is diagnosed with osteoporosis,
Yeah.
there is a treatment or
Yeah, so the treatment for that could be medication. If somebody having severe osteoporosis and we had to treat them, so there are medication you can take, and that could be medication helping building the bone density, or a hormonal therapy replacement, because one of the reasons which can cause the osteoporosis is the thyroid gland and the parathyroid gland is called. There are two glands we have in our neck. One of them is the big one, which is called the thyroid, and the other one is a small one, which is on that gland. So there are two in the same place, and that usually missed or misdiagnosed. By taking the hormonal therapy, you could also balance the intake of your calcium and so on, building it up to a good state.
and after that people recover, or is it something that they will always be living with?
Usually they have to take it for a longer period, especially with the ladies. But some of these medication you shouldn't take it for a long time, because especially the ones with the hormones. So there is limit on how long you should take these medications, and that's not something you can get, yourself. It's not self-medication. It has to be done by a specialist.
Yes.
Because you have to be followed with blood tests and so on. And so always a good idea to contact a specialist about that.
Yeah, that's what we keep saying, that
Yeah.
it's just always better to
Yeah.
go to the doctor, get your checkup, and just see what you actually need.
Yeah.
Okay. What advice would you like to give to everyone listening to us today?
Most important one is your vitamin D. Many people, they sometimes I get some patients who are complaining of pain, like body ache and muscle ache and things like that. And if you dig deep into the symptoms, you find out that they have vitamin D deficiency, and some of them is so severe that it's almost zero. They have like 5 or 10 or even 15 something in this, and that can cause to serious issues. So vitamin D should always be level, exercising, and again with the exercising, it shouldn't be that you have to go to the gym and do weightlifting and spend lots of time there. We're talking about simple exercises which anybody can do, as walking, for example, very good idea. Swimming, if you have the ability to do that, or just simple cardio, you can do that anywhere or even at home. Just keeping, your body and muscle strength on, that would be a good idea. And healthy diet, and getting rid of the bad habits, of course.
Any specific bad habits you'd like to mention?
I can mention the smoking, yeah, and the fast food. All the fast food would be a bad idea. Not just for this, but for in general.
Overall health,
Yeah,
it's
for
not really
general
healthy.
health.
Yeah.
So that's what I would be definitely recommending.
Okay, what about the whole myth of you have to drink your milk every day, your glass of milk to get
Yeah.
your calcium, to get strong bones?
Yeah.
How true is this?
No, it's not. Of course, it's a good idea to drink milk, but it's not enough. It's not enough because if you have, as mentioned again, if you have low vitamin D, your calcium, no matter how much calcium you will take, it will not be absorbed from your stomach. And also because of the bad habits, some people takes some protection for their stomach, for the heartburn and things like that.
Yeah.
That can also lead to inhibition of absorption of the calcium in the stomach. So that can be related indirectly to this. Yeah.
Okay, but like as a maintenance, like if someone they don't have weak bones or anything, they're good in condition and they want to continue being in good condition.
Yeah.
So then the milk is helpful.
The milk is fine. Yeah. The milk is fine, but not the reason.
Yes.
Yeah.
Yes, we know. We always say that it's always something like it's a combination of things.
Yeah.
So
Yeah.
you can't be like drinking milk, but then having fried chicken every day, and then obviously it's not.
Exactly.
Any other myths that you would like to, debunk about bone health or osteoporosis?
I would say this again with the weightlifting. I hear from many patients and people who I meet in daily now my daily routine. The weightlifting. Some of them they go like crazy with weightlifting, and I think it's not a good idea to do that, especially if you're not fit, and especially if you're in a certain age and suddenly you decided to train or exercise. Because most of the surgeries I do usually is, I would say, a big percent of them, somebody went to the gym and start going crazy with the exercising and they hurt themselves, whether with their ligaments, with their back, with their neck. So I would say just moderate, simple exercises, as we mentioned before, simple walking, simple cardio you can do. And just if you need to have weightlifting, it should be very simple and low, light weights to be lifted.
Yeah, actually, this is something that I've also heard quite frequently that weightlifting is like the best form of exercise for your muscles and for your bones long term.
Yeah.
But then I think it also hurts the joints.
It does. It does if you're overloading it, and also another factor is that stretching. Some people they don't do stretching enough
Yes.
before starting exercising. That will also that's also very important. And the position you're doing it. Like if you have already some problems in your back or in your knees, better to lie down and do the exercises. You can modify your way how to do it. That would be also a very good idea.
All right. Thank you. Thank you so much, Dr. Kutaiba, for
Thank you.
joining us today. This was very informative. So
Thanks
thank
a
you
lot.
so much.
Thanks for having me. Thank you.
To everyone listening, we hope you learned something new today to help you take some steps towards a better health. We're available on both the YouTubes, Spotify, Apple Podcast, Anghami, and Amazon Music. Stay well and keep thriving.